Dear students, we are like 1 month away from the INICET exam. Less than 2 months are left for our NEET PG exam, and we are slightly more than 2 months away from the FMGE exam. These last weeks and last months are extremely important because this is when the anxiety starts playing a significant role in what we do and where do we end up. Unfortunately, in the next weeks, anxiety would result in derailing the preparation of many students. Many students would find it difficult to continue going, and some of you would also stop studying, thinking that it's no longer possible, we'll do it next year. We have to do everything possible to minimize the impact of anxiety on our preparation. How do we do that? All of you are doctors, all of you are medical students, you understand how these things work. And to minimize the impact of anxiety, we have to understand how anxiety works. The fundamental property of anxiety is that it shows you the worst possible scenarios. It tells you that the worst possible thing is about to happen. If you are revising and if you cannot answer one or two questions, the anxiety will not let you think that I could not recall one or two questions or one or two answers got wrong. The anxiety will exaggerate it. The anxiety will tell you that you cannot recall anything. You have forgotten everything, right? Similarly, if your GT scores are not improving, your anxiety will tell you that only your GT scores are not improving, everybody else is doing well. If your preparation is lagging behind, your anxiety will tell you that everybody else is well prepared, it's only you who is lagging behind. See, this is what anxiety does. It shows you the worst possible scenario. And how do we manage it? We have to develop the art of responding back to those anxious thoughts. That is what we also do with the patients. When we do CBT, cognitive behavioral therapy, one of the important aspects is assessing these anxious thoughts and being able to answer them. And that is what you also have to do. You may not be having clinical anxiety, but the principles remain the same. First of all, when you get a thought that I have forgotten everything, then you have to remind yourself. You have to reframe that thought in your head. You have to tell yourself, no, it's not that I have forgotten everything. I'm not able to answer these 2-3 questions. Those two things are not the same. When your mind tells you that 2 less time is left, you would not be able to complete the syllabus and you would perform very badly. Again, you have to tell yourself that it's not only me. Completing syllabus is a very difficult thing. Rarely anybody is able to go to the exam with completion of syllabus. Everybody goes with something left, and you are in the same boat. Anxiety will tell you that just give up, there is no point studying. But then you have to remind yourself that taking the preparation to the last day is like half the game won, right? Dear students, these motivational videos, these supportive videos would come and go, but finally you have to develop that capability of being your own therapist. You should, and you don't need a degree for that. Being able to fundamentally understand how these things develop and being able to answer them with a logical manner is all that you need. So please remember, the next few weeks are going to be tough. Your mind will play games. Your mind will tell you that things are way more difficult than they actually are. Your mind will also tell you that you are the only one who is in trouble. Rest everybody is doing very good, which is also not true. We have to keep moving. We have to continue sleeping for 7 hours or 8 hours. We have to continue eating properly. We have to take care of our own body, and we have to take care of our mind. Please remember, there is no person in the world who goes to the exam with everything complete, everything revised, all things done, all Q-Bank done, all modules done. It just doesn't happen. There is just not enough time. So our aim is to continue studying till the last day, to continue as much as possible, not to lose nerve, not to waste time in these anxious thoughts. And see, what happens is we get anxious about being anxious. We feel palpitations, we feel feeling of nervousness. One day we are not able to sleep, and then we are like, what's happening to me, right? So anxiety about anxiety. So we have to control all these things, and these things can be controlled by using certain simple principles that I just discussed. It's okay. You have reached till here. It was difficult. It is going to be difficult, but we are just 2 months away from the final exam. All we have to do is to keep ourselves calm for 2 months and then take the exam. If too many thoughts are coming in your head, just ask a simple question. Are these thoughts, all these questions helping me with the preparation, or are they hampering my preparation? Whenever any thought pops up in your head, this is the benchmark question, or this is the litmus test for you. When a question pops in your head, when a thought pops in your head, just ask yourself, is this thought hampering my preparation or helping with my preparation? If the answer is hampering my preparation, you would not give any mental space to that thought. You should not get into that loop, see, trying to answer it and then becoming more anxious and then trying to, it's digging a hole for yourself. The only way of not ending in that hole is to not dig it. Do not answer that question. You have to tell yourself that this thought is going to hamper my preparation. I am not going to think about it. The only aim that I have today is that I have to continue studying till the last day. That's it. So, please understand, it's going to be difficult. It's not your fault. It is actually very difficult. It's not that you're a weak person or you're a sensitive person. It is a damn difficult thing. You have been doing great. Just keep doing, just keep moving forward. Let's take the preparation to the last day and things will fall in place. All right, my dear students, may God bless you all. Keep working hard. Take your preparation to the last day. All the best.